Hello, and welcome to this EpiPen Adrenaline Auto-Injector training. This video will show you the main features of EpiPen, how to correctly administer your EpiPen. Watch this training often. Show it to your friends and family or teacher in order to ensure that you are totally familiar with how your EpiPen works. Try using your trainer pen when you watch this video so you know how to use your EpiPen in an emergency. This is the EpiPen Auto-Injector. It comes in two strengths, one for patients weighing more than 30 kilograms, 4 stone 9 pounds, it has a yellow label, and one for patients weighing between 15 and 30 kilograms, 2 stone 5 pounds and 4 stone 9 pounds, which has a green label. That is EpiPen Junior. Both EpiPen work in the same way. Make sure that wherever you are, you always have your EpiPen with you. It is recommended that you carry 2 EpiPens with you at all times. What to look out for? The EpiPen is clearly color-coded. As you can see, the safety cap is blue and the needle cover is orange. This is so you can quickly see which end is which in an emergency. An easy way to remember this is blue to sky and orange to thigh. The needle sits inside the orange casing, and this casing automatically covers the needle once the EpiPen has been used, so that you never see the needle. The case also protects you from unintentional needle injury following use. The viewing window lets you check that the solution is clear and colourless. It is important to check this regularly, as you need to replace your EpiPen as soon as possible if the solution becomes dark or cloudy. The viewing window also allows you to check that you have used your EpiPen correctly. When the dose of adrenaline has been injected, the window becomes darker. As you can see, there is a noticeable difference before and after each injection. The instructions on the EpiPen are easy to read and clearly illustrated. This gives you or someone with you immediate access to the injection technique in an emergency situation. Your EpiPen comes in a hard carry case. You should always keep your EpiPen in the case to protect it from damage and light, which can degrade the adrenaline. Using your EpiPen is easy. There is no need to remove clothing, but make sure the orange end will not hit buckles, zips, buttons, or thick seams on your clothes. To remove EpiPen from the carry case, flip open the lid on the carry case. Tip the carry case and slide the EpiPen out of the tube. Grasp the EpiPen in your dominant hand with the orange tip pointing down. Remove the blue safety cap. Hold the orange end about 10 centimeters away from your mid-outer thigh. Once the blue safety cap has been removed, the EpiPen is ready to be used. Swing and jab the orange tip into the thigh at a 90-degree angle and hold in place for 10 seconds. Remove the EpiPen and massage the injection site for at least 10 seconds. After use, the orange needle cover automatically extends to cover the needle, so that the needle is not seen before, during, or after use. You or someone with you must dial 112. Ask for an ambulance and say anaphylaxis, even if your symptoms appear to be improving. It is important that you don't get up or move around. Stay laying down or seated and have someone stay with you if at all possible until you have been seen by a paramedic. Unconscious patients should be placed on their side in the recovery position. You can only use your EpiPen once, so hand the used EpiPen to the paramedic. If you are not feeling better after the use of the first EpiPen, then you may need a second injection with a different EpiPen. This can be given 5 to 15 minutes after the first. You should therefore carry 2 EpiPen with you at all times. If you think you have come into contact with your allergen and start to experience severe symptoms, you should use your EpiPen immediately. What to watch out for? Difficulty or noisy breathing, swelling of tongue, swelling or tightness in the throat, wheeze or persistent cough, loss of consciousness or collapse, pale and floppy in young children. And finally, remembering these key points will help keep you safe. Know your symptoms and when to administer your EpiPen. EpiPen must be injected into the thigh. Do not inject EpiPen into the buttock. Blue end to sky, orange end to thigh. Check the viewing window regularly to ensure the solution is clear and colourless. Check your expiry date. Sign up for the free expiry alert service by visiting www.epipen.ie. Ring 112 and ask for an ambulance immediately after administering your EpiPen, even if symptoms are improving. Stay laying down or seated until you have been seen by a paramedic. Each EpiPen can only be used once. Hand to a paramedic after use. If you are not feeling better, you may need a second injection with a different EpiPen. This can be given 5 to 15 minutes after the first, so be sure to carry 2 EpiPens with you at all times. For further information, read the leaflet in your EpiPen box or visit the EpiPen website. If you have any concerns, talk to your doctor or pharmacist. Reporting of side effects. If you get any side effects, talk to your doctor, pharmacist or nurse. This includes any possible side effects not listed in the package leaflet. Please report side effects to pv@maida.ie. By reporting side effects, you can help provide more information on the safety of this medicine.